Well, August happens to be National Breastfeeding Awareness Month, and here to provide tips for new moms is UC Davis Health obstetrician gynecologist Dr. Melissa Chen. Welcome to the show, Melissa.
Thank you.
Okay, so let's help our moms understand the benefits of breastfeeding.
Well, there are multiple benefits of breastfeeding both for baby and for mothers. So for babies, for example, breast milk has antibodies that help strengthen the immune system and decreases the risk of getting infections like ear infections, lung infections, diarrhea. In the long run, babies who are breastfed also have a decreased risk of developing diabetes, obesity, allergies, asthma, and we can't forget the benefits for mothers as well. So from a short-term standpoint, mothers have less bleeding after delivery, they burn more calories, so they lose their pregnancy weight faster, and they have a later return to their menses, so that helps with birth spacing. In the long run, women still have benefits, so they have a decreased risk of developing high blood pressure, diabetes, and even things like breast and ovarian cancer.
Wow.
And so because of all these benefits, the recommendations are to breastfeed exclusively for 6 months and up to a year if possible.
Okay, so as long as you possibly can. Okay, so give some tips for some expecting and possibly new moms.
Yeah, so a few general tips that I usually give my patients are, one, to do skin to skin as early as you can, usually within the first hour after delivery. And that's just putting the baby on your chest, and that will help initiate breastfeeding. Second is to stay hydrated, drink lots of fluids. And the third thing is to be prepared, because breastfeeding comes naturally for some women, but it can be challenging for others. So learning all you can before you deliver is helpful. So breastfeeding classes will teach things like how to tell if your baby's hungry, how to tell if you've given enough milk, and different breastfeeding positions to make it easier.
Yeah, and for those moms that have been down this path before, you know that each child is different too. So
definitely,
even if your first child does well, and then your second child, you're like, oh, I got this in the bag. Always best to be prepared,
definitely,
right? And kind of brush yourself up on some of those skills too.
Definitely.
What about the support that mothers receive at UC Davis Health?
Yeah, UC Davis has a great breastfeeding support program. So we have the classes, like I mentioned earlier. We also have lactation support both in the clinics and the hospital setting. And there's also a weekly breastfeeding support group where moms can bring their babies and feed with lactation consultants there to help them. And it's also a great place to connect with other new mothers that are going through the same thing.
Absolutely. We all know the power of a community and having that support together, because when you can hold someone's hand and go down the path, a lot easier than when you feel like you're doing something by yourself, right?
Yep.
Okay, and so where can our viewers go for more information about this?
Well, they can go to our website, children.ucdavis.edu, if they need more information.
Okay, and that's where they can find information about some of those classes possibly coming up?
Yes.
Okay, and really quick about those classes, for expecting mothers, should they start taking them now, or are those classes they should take once the child arrives?
There's prenatal classes when they take during pregnancy.
Okay.
And so that helps getting prepared before they deliver.
Okay, and then once the baby arrives, are there classes though to help moms that maybe just having a little bit of a challenge getting the rhythm going with their child?
Yeah, after delivery, usually it's best to work with the lactation consultants, for example, because there could be different problems that are more individualized to different mother-baby pairs. So working with a lactation consultant directly or other educators would be helpful.
Wonderful. Okay, and that website one more time?
Children.ucdavis.edu.
Thank you so much.
Of course.
Really appreciate it,
Thank
Doctor.
you.
Okay, everyone, stick around. We got a news update coming up next, right here on Fact and Show.
Thank
This
you.
segment paid for by UC Davis Children's Hospital. This interview involves commercial content. The products and services featured appear as paid advertising.